Good morning, I'm Dr. Lindsay Nelson. Today I wanted to talk about heartburn and the use of PPIs, or what's better known as protein pump inhibitors or acid blockers. There are more than 15 million people on prescribed PPIs, protein pump inhibitors, and that doesn't even come close to accounting for all the people that are on over-the-counter PPIs. For a long time, PPIs were prescription only. Now they've become over-the-counter. So millions and millions of people are on protein pump inhibitors. These are often prescribed for heartburn, GERD, acid reflux, peptic ulcers. We're all kind of talking about the same thing, except for the peptic ulcers. GERD affects about 20% of Americans. So it's pretty common, but I just wanted to clarify that heartburn is the symptom of acid reflux and GERD. GERD is basically just chronic acid reflux. So I just wanted to make that distinction because I think people throw GERD and acid reflux around, and not always when you have heartburn do you have GERD. GERD is going to be a much more serious chronic condition. Some of the symptoms are burning, burning in sensation in your chest, maybe even in your throat. Some people can feel it, all along their chest. Chest pain, difficulty swallowing is a big one. Regurgitation of food or liquid can be a very common one. Sometimes people feel like they have a sensation of a lump in their throat. I see I see actually a dry cough quite often. People just kind of have this, at night when they're sleeping. Laryngitis is common. New or worsening asthma is something that people, if they do have asthma and it's new or it's worsening, something to consider. And then, of course, most of the time, heartburn is happening at night when we're sleeping, so we see a lot of disrupted sleep. A lot of missed work and that type of stuff because of disrupted sleep. PPIs basically work by stopping the production of stomach acid, and this may help with the symptoms of heartburn temporarily, but when you're stopping the production of stomach acid, that really affects your overall digestion, right? So stomach acid is what turns on your digestive enzymes. Your digestive enzymes are what then start breaking down your food, right? We start breaking down our macronutrients to get all those micronutrients, all those vitamins and minerals. And so when we see people on PPIs chronic for long term, we start to see a compromise in nutrient absorption. Some of the big ones are B12. That's a really, really big one that I see. B12 deficiency can lead to anemia. Depression is very common. Fatigue, just like utter fatigue. Changes in like nerve conduction, muscle fatigue is another big part. Weakness. It's a big risk factor for cardiovascular disease to have chronic B12 deficiency. Another deficiency I see is folic acid, another one of your B vitamins. With that, we see some birth defects, cervical dysplasia, anemia, maybe heart disease, cancer, might be implicating cancer. Vitamin D is one where we see muscle weakness, osteoporosis, hearing loss. Calcium is another big one. So you see a lot of your minerals can be a problem. We see osteoporosis, heart and blood pressure irregularities. Calcium is very important for maintaining a proper rhythm. Tooth decay, iron deficiency, anemia. Iron deficiency, we'll see anemia, we'll see weakness, fatigue. People complain about just feel like they're sludging along, their legs are super heavy, maybe hair loss, brittle nails. And then the other one that we see quite frequently with people on PPIs chronically is a zinc deficiency. And zinc really is important for supporting your immune system. So we might see a weakened immune system. People might lose a sense of smell or taste, and there might be some sexual dysfunction. We also know that chronic use of PPIs can change your gut microbiome, and changing your gut microbiome can lead to potentially overgrowth, bacterial overgrowth, or SIBO, small intestinal bacterial overgrowth. PPIs can affect the health of organs outside the gut. And this is what I think is really important. There's been a lot of new studies to show that chronic use of PPIs can affect your kidneys and your heart and lead to other chronic health conditions. A new study showed that people had a 17% higher death rate for people on PPIs. And the cause of death was usually cardiovascular disease. We already are, all of us, at risk for cardiovascular disease. We don't need to add anything to it. Stomach cancer and chronic kidney disease. It actually affect the kidneys more. Another study also showed that there is an increase of the increased risk of getting diabetes by 25%. That's pretty big. And both studies found that the risk of death or getting diabetes increased with the duration of time, not necessarily with it increased with the duration of time, regardless if the patient was on a low dose of the drug. And this is really important because PPIs were first prescribed for short-term use only, right? That even said on the label, do not take longer than 14 days. But sadly, most people are taking these long-term. They're taking them every day, and it's mostly because they don't know what else to do. And heartburn can be a very serious symptom, very uncomfortable. Like I said, it can affect your sleep and it can be pretty painful. And so from my point of view as a naturopath, PPIs aren't fixing the problem. They're not fixing the underlying problem. They're just suppressing the symptoms. And if you're not fixing the underlying problem, then you are going to have to be on a treatment for the rest of your life. There are plenty of natural options for suppressing stomach acid, but as a naturopath, my job is to find the root cause of disease. So places that I always start to look for causes of heartburn would be hidden food and intolerances or sensitivities. It's very common for people to have these, and maybe they're not having, what they would consider a food allergy, where their face is swelling or they have, diarrhea or something, but they can be getting heartburn from it. And so I always look for hidden food sensitivities and intolerances. I'll look for a potential infection like H. pylori. H. pylori is a bacteria that stays mainly in the stomach. Stress is a huge one for, I would say, my population of patients that come to me. A lot of people suppress anger and frustration in their stomach. And so I see a lot of stress. I always look at diet choices, right? Are you eating fried foods? Alcohol is a big one, coffee, we want to look at how much of those are you drinking. And then we want to look at your diet hygiene. Are you eating those foods and at what time? What's the quantity of your food intake? What time you're eating? A lot of people with this day and age, they're eating and then they're going to bed and that food is just sitting there, right? And we have to remember that sleep is your parasympathetic time. So, you're trying to rest and it's not really a time to, I guess parasympathetic is rest and digest, but sleep is a time for you to go to sleep and not be digesting your food. I'll look for people who have a hiatal hernia. Hiatal hernia is when your stomach pops through a little hole in your diaphragm. And so that's actually really easy. I can give you some exercises that you do in the morning that can greatly help with that. And then we have to look at, are you overweight? Too much pressure there. And so if that's the case, then maybe we put you on a new diet plan. But as I am trying to find the root cause, I am also going to help you with the symptoms because that is important. No one's going to stick with me if I'm trying to, let's say, get them to lose weight if they're having a lot of symptoms. And so some of those natural alternatives for heartburn, and it really would depend on what we think the underlying issue is. You'd be surprised, many people who have heartburn, it's not too much stomach acid, but it's too low stomach acid. So sometimes digestive enzymes or apple cider vinegar before meals helps these patients. If you are not one of those people, though, I would definitely, if you are someone who has high stomach acid, I would not be doing apple cider vinegar. That's going to hurt. DGL is one of my favorites. D-glycerized licorice. You can get them in chewable forms. Some of them taste like chocolate. Some of them taste like black licorice. And those are really soothing, especially when you get it in a chew. They're anti-inflammatory, so they actually help heal the gut lining, the stomach lining. Ginger is a great one. Ginger can be very soothing. You can get ginger chews, ginger tea, you name it. An old school remedy is just a little bit of, I think it's like a teaspoon of baking soda and water and drinking that, and that can help immensely. There's a lot of wonderful teas out there, like slippery elm and marshmallow. Again, those are really great at coating the lining. Chamomile is a nice one too. Gum, just chewing gum after a meal can help neutralize the stomach acid and soothe the esophagus. There are a lot of companies now that are making herbal support or like baking soda or other things in the gum. So there are a lot of alternatives, but I would say as a naturopath, very important, we always want to find the root cause of disease. So while I can give you natural alternatives, we want to find the root cause of disease. And I do believe that it's very important to use alternatives, natural alternatives. Most of you, I think everyone here has been, might be a patient, I shouldn't say that. Most of you that are listening have been a patient of mine. You know that I am not anti-pharmaceutical drugs. There are a lot of drugs that I do prescribe, but I will say PPIs are just not worth the risk when there's so many natural alternatives that really work. And so I would really stress that if you are having an issue with heartburn or GERD, that you give me a ring and let's find some alternatives for you and get to the root cause of disease. Does anybody have any questions for me? You can put them in the chat box, or you can unmic yourself and ask. How is GERD different than EOE slash? So GERD is the GERD is just going to be chronic acid reflux. Oh, eosinophil esophagitis. That's going to be more of an allergic reaction. So we're going to have to look at what's causing those eosinophils to be upregulated. And that's usually going to be a hidden food allergy or food intolerance. GERD is just looking more at the stomach acid. Any other questions? Nope. Okay, then I guess I'll call it. If anyone does have any questions or knows someone who has struggling with heartburn, please send them my way. They can reach out to me at drlindsaysnelson@gmail.com, or they can get on my website. It's easy to connect with me on my website, drlindsaysnelson.com. And a copy of this, if you want to listen to it again, will be on my website by this afternoon. Thank you everyone for attending. It's so nice to see all of you. I do appreciate you guys showing up. It means a lot. Bye.
Thank you.